Hello everyone, I am honored to present the results of our paper, Prevalence and Urodynamic Characteristics of Voiding Dysfunction in Obese Women. I have no disclosures. Obesity is a worldwide public health issue affecting almost 2 billion adults on the globe. Overweight, besides increasing cardiovascular risk, is also a risk factor for lower urinary tract disorders. Urinary incontinence is directly related to obesity. Given the significant impact in the quality of life and functional impairment, it is crucial to identify and treat LUTS. Our project aimed to assess the prevalence and urodynamic pattern of obese women in the bariatric surgery program of the University of Campinas and compare them with the general population with same age. We designed an observational prospective study. All patients were submitted to a physical examination and a complete medical background. We also collected blood samples for laboratory evaluation. We assessed the impact of symptoms through ICIQ questionnaires. And finally, all women underwent urodynamics. We evaluated 109 women. The average age was 42.5 years. Patients had an average 45 body mass index and 128.6 centimeters of abdominal circumference. Most of them, 72.5%, were morbidly obese. According to the Baden-Walker prolapse classification, the significant majority had no prolapse or a small one. In obese women, the prevalence of stress urinary incontinence is between 2.5 and 5.5 higher than eutrophic women at same age, compared to the epidemiologic study conducted by Irving et al. Regarding overactive bladder, the prevalence is between 2.6 and 3.6 higher in our group, comparing them to non-obese women, as we can see the result of Milson et al. Regarding urodynamics, the results were very similar to clinical diagnosis. 50.45% were normal, 33% had Detrusor overactivity, and 16.51% stress urinary incontinence. This table shows us that obesity is directly related to bladder sensitivity. The morbidly obese women had their first sensation and first desire to void with statistically significant less volume than obese and severe obese counterparts. There are experimental studies trying to explain why this happens. These alterations are probably related to a higher leptin production by the adipocytes, which can stimulate the sympathetic nervous system, leading to a higher urinary frequency. The leak point pressure in the morbidly obese women were significantly higher compared to the other group. A possible reason is a much higher abdominal pressure transmitted to the urethra during intercourse due to excessive fat tissue in the abdomen. As expected, the patients with OAB or stress urinary incontinence have a sensitivity impact in their quality of life. As we can see on this graphic, both questionnaires caption this impairment, with asymptomatic women having around 4 points on ICAQ OAB and 4.7 points at ICAQ short form. When we analyzed the group with OAB symptoms, the average results were 8 and 12 points respectively. Similar results were seen on patients with stress urinary incontinence. This impact should not be underestimated, since those patients are under higher levels of stress, anxiety, depression, sleep disturbance, and fatigue compared to asymptomatic women. Concluding, the prevalence of stress urinary incontinence is 2.5 to 5.5 times higher among obese women compared to non-obese women. OAB prevalence is 2.6 to 3.6 higher. The degree of obesity is directly related to increased bladder sensitivity, and the leak point pressure among morbid obese women is higher than obese women or overweight women. Thank you very much.